Okay. Timer is on, and here is the question. Right. If you have read and understood, kindly begin your examination.
Okay, ma'am. Hello, I am Muhammad Al-Ayan. Wash my hand. Hello, I am Muhammad Al-Ayan, one of the
Yes.
exam candidate. May I confirm your name and age, please?
Yes, go ahead.
Today, I have been asked to examine your the neck that any cloth lock and veil and listen to your neck and move your arm and leg. Are you okay?
Yes, go ahead.
Would you please lower down the collar of your gown? Now I will start by talking close look. Would you please take a sip of water for me? And then would you please swallow it for me? And then would you please stick out your tongue for me? And now comment for the swelling by inspection for the side, the size, and then the shape, the scar, the surface, and overlying skin, and inspect the neck vein for any distended. Now I feel the neck from the back. I am asking the patient, do you feel any pain at the moment? And then would you please take a sip of water for me? And would you please swallow it for me? And would you please stick out your tongue for me? And during the order, palpate for the tenderness for the swelling, painful or no, and the temperature by the dorsum of the hand, and compare with the another side. And during palpation, comment on the consistency. Use palmar surface of your finger, and then pulsatile, feel pulsation used by tip of the index and the middle and ring finger, and then hold the skin between your thumb and index to see if the skin is adherent to the mass as skin skin pinching test, and then feel below the leg length or no. Now would you please raise your head little bit backward for me? Look for presence of exophthalmos, and then would you please push against the hand? Use your chin to confirm the swelling related to sternomastoid. And now will tap. I am asking, do you have any pain at the moment? And then would you please hold your breath? I will listen for any breath. And then feel your windpipe to comment the windpipe centralized or no. And now I will your neck pulse to examine and feel the carotid pulse. And then would you please keep your head steady and follow my finger. Use your eye. Ask a lid lag test and eye movement. The lid lag, hold your finger high and ask the patient to follow the finger with their eye, and move your finger downward, and observe the upper eyelid of the patient. Follow your finger downward, and ask the patient to keep your head still and follow your finger with their eye. Move your finger through various axes of eye movement, as upward and medial, upward and lateral, and lower down, medial and lower down, lateral, and observe for any restriction of eye movement and painful of eye movement. Ask the patient to any report any double vision or pain. And now, would you please stretch your arm in front of you and close your eye? I will put on your hand to exclude any tremor. And then now you can open your eye. I will your pulse, radial pulse.
Good.
Comment the regular or no, and the volume. And now will you tap? I am asking the patient, do you have any pain at the moment? Now I will tap the biceps reflex to note any contraction on the biceps muscle. And then would you please expose your leg? I will take close to your leg to exclude and examine peritibial myxedema. And then I will tap the reflex. Ask the patient, do you have any pain at the moment before the test? Ask any reflex and comment on the contraction of the quadriceps muscle. And now, would you please cross your arm, cross your chest, and stand for up for proximal myopathy. And thank you, sir. Your my dress now. Do you need any help? And wash my hand. Thank you.
Good. Still have, okay, can you present your case? 20 seconds are left, doesn't matter.
Yeah, I examined the patient complaint of the neck swelling of patient of the 62 years old lady in your surgical outdoor has presented at the surgical outdoor with the swelling in the front of the neck since 8 months. The swelling not painful, that cause discomfort with the swelling.
What are your differential diagnosis?
Yeah, the differential diagnosis could be thyroid neoplasm, and could be simple nodular goiter and multiple nodular goiter and thyroiditis.
Very good. How would you manage this patient?
Then manage the patient after history and examination and the investigation. I would like the ultrasound and fine needle aspiration or biopsy, and I have to check thyroid function test.
Okay. And what should be the management?
The management after history and examination and investigation, and after MDT meeting and work up as thyroid function test and the ultrasound and the CT scan to exclude metastasis of the thyroid neoplasm, CT chest and the abdomen and pelvis, and the tumor marker as thyroglobulin. And then the management could be total or hemithyroidectomy for the neoplasm, and follow up the patient every 6 months with the tumor marker as the thyroglobulin, and give the patient thyroxine.
All right, just suppose a patient, you're looking at a patient. This patient comes back after a few months and has swelling and difficulty in breathing. So how would you manage her then?
Yeah, patient coming with difficulty, your breathing patient coming with obstructive symptom, patient require and the mandatory thyroidectomy.
Would you go and do the, okay, would you go ahead straight and do the thyroidectomy? Okay. What about if you have done the biopsy report and it says unable to differentiate carcinoma from adenoma, how would you interfere it then?
Yeah, the follicular carcinoma differentiated from the follicular adenoma as the inflated tumor capsule or the surrounding physilis, and therefore the histology rather than simple cytology is needed.
Very good. Yeah. Okay, good. For follicular carcinoma, what is the 5-year survival rate?
What's ma'am?
A 5-year survival rate for follicular carcinoma, how much is it?
Yeah, 5 survival rate of the follicular carcinoma more than 90%.
Yes, very good. Triple assessment. Yes.
Yeah, the body prognosis, this is anaplastic than follicular and papillary carcinoma of the thyroid.
Very good. Excellent. Yes. Thank you.
Thank you, ma'am.
Yes, it was very descriptive and it was given within the time, so I'm happy. And you covered everything.